It's interesting. It came out of a visiting professor talk, and I was asked to go to my alma mater, Ohio State, and do a visiting professor lecture, and it was on behalf of in honor the lectureship was Claudine Dent, and she was the first Black woman physician, and so it was kind of a diversity talk, yes, but at the time, Simone and I had been talking a lot about humanity things, and I was having lots of frustration with regard to humanity and leadership and in healthcare. And I was like, what a great opportunity to have a discussion about that for this visiting professor. Like, I can talk about orthopedics all day long, but this was not an orthopedic invite. And the lecture was very well received. I was surprised at how well received it was because it was, it was a little bit, I think, of a leap of faith, to have a physician talking about some of these things because as physicians, we just don't advocate, period. It's tragic almost. And I don't know if the evolution of the modern day physician it's kind of we've been pushed that way. We're not seen as leaders. We're almost seen as just cogs in a system where before physicians owned the healthcare space. Like if you were sick, the first thing people thought was, I need to see the doctor or I need to see the healer. And now that is not what happens.
Yeah. Leah, when you think about, so one, your article, I'm looking at it right now, was was titled The Future of Medical Leadership: Humanity, Expertise, and the Fight Against Ideology. And you describe it as this futuristic view, but you describe it as a fight. What are we fighting for?
We're fighting for, the integrity of the space. And I think that we have seen healthcare become a business, and not an art or humanity that it has always been. I think of healthcare as healing. I think of my job as a physician is to heal, and my skill set is diverse. And it is to heal either through cutting, to heal through not cutting or avoiding it, using all of the other experts in the healing space. Um, or sometimes it's just a hug and a talk through and reassurance. There are a lot of skills that we have, um, and I think they had previously been described as soft skills. These are hard skills. These are core skills, and I spend so much of my time not in that space now.
Yeah.
Um, I am even trying to in my healing part of my job, I'm having to educate, which is fine, but I'm educating in a different way. I'm having to almost justify. You almost have to feel defensive because you have, I think, and I'll just be honest with it, you have people who are being insincere with their desire to push information for their own gain. And my whole gain is to heal my patient, and whatever that looks like. And we have become a business in delivering something vice healing.
Yeah. You talked a little bit, and Allison, tell me if this is where you're thinking about going, about your use of AI in one of our board conversations. And when we think about something we're seeing in the business world, it's this conversation around efficiency and making people more productive by using technology. And as much as you feel the need and the calling to be a healer, you're also adopting some of the technology, which is making you more efficient, which is actually helping the business.
Right.
Well, what is that? What's your journey with AI been? Because in many ways, if physicians get to use AI more effectively, might it get you back to the healing work because it's helping you be more efficient in the work, which is obviously one of the goals of typical business environments. So, thoughts?
That is exactly the case. And so in our desire to resume that intimate contact, that intimate patient physician relationship and to restore that, there's a part that needs to happen, and that's connection. And at least some of my initial use in AI in my delivery of medicine is making me more efficient. That's not typing at a computer while I'm talking to a patient because my note is being transcribed real time. It's because I can quickly do a comparison evaluation with outcome studies that would normally take me hours, and it takes me just a couple of minutes to obtain the information and to have an appropriate comparison. I think when we are sincere with our use of AI, it can be an incredible equalizer when it comes to helping our outcomes be more equitable, equivalent. I'm very enthusiastic about it. That's where we really have to lean into the integrity of what we're doing. And again, so it's the humanity of understanding this is about a greater good. This is about doing the right thing for the most people. And you know, being a productive business, I don't discourage that. I think it's fine to have a productive, successful, financially incentivized business, but you have to incentivize it the correct way. And you have to do the right thing to get the right outcome for the most amount of people.
Humanity at scale. When you, I'm going to go off script a little bit on this one. A couple years ago, you and I talked about the achy 40-year-old woman. Do you remember this conversation?
Yes.
And and I at the time was not yet an achy 40-year-old woman.
Yeah.
Um, but I've had lots of conversations with friends as we're aging and what we've seen as we've aged and the lack of understanding of the female body and there's so much work happening in that space. But you described yourself as a healer, but you're also a scientist. You're also an educator. You're a mom. What's your sense when we talked about that of what's missing in the profession and the role that you, others, we have to help make sure we don't lose that for the sake of humanity and the achy 40-year-old women out there?
I think as we talk about the perimenopausal space, it's exploded. And I think it's one it's probably the best indication of how a social media movement or how kind of our new way of getting information and putting out information has changed how women are receiving healthcare. The difficulty is you have grifters, you have non-science, you have a lot of information out there that's a struggle. And as a scientist, there are reasons why we have to do things. And I think that, and this is not all to say that physicians have always had it right, and there's no room in the space for anyone other than a physician. That is absolutely not what I'm saying. But what I am saying is that it is important that we follow through in a scientifically respectable way so we don't cause harm in the long run. The last thing we would want to do is to have this revolutionary movement to help the achy 40-year-old woman be more than just quote hysterical, and go back to being this fully functional self, like the old person that they felt without having some harmful thing done because we did not do it the right way. And we did not hold everyone accountable for the information that they put out, for the things that they're doing. So accountability is definitely a part of it. But I definitely think this is an excellent example of how we can use all of this new technology and this new way of communicating to our advantage.
Yeah, in your piece that you wrote, you talked about the future of medical leadership and expertise was a part of it.
Yeah.
And for sure, there are a lot of people that people follow in our space as well, where you get the 10 things to do or the five, right? The listicles. What makes that really hard for someone in your profession?
I think the I think we all have to be honest with ourselves in that we can't dole out the term expert um, just generically. There is a reason why people go to school. There's a reason why there are licensing boards, there are accountability boards, there's liability insurance. And when you're having to operate under those premises, that means there's accountability. You have had to demonstrate that you're an expert. When you remove those kinds of guidelines and you allow people a platform to yell or even have a louder voice, because social media and the way that our communication systems have evolved in the last couple of decades, it allows anyone to have a platform. And the way that we receive information is it's now about being the loudest and the most frequent and not about the most accurate. And we have to come up with a way to direct to either quiet the noise because there's a lot of noise and we see the ill effects of that noise. It's harmful and it can be very, very harmful. It can be indoctrinating. It leads to ideology or is being manipulated by ideology. So that accountability is in place for a reason. There is also a reason these so-called self-proclaimed experts don't want to go through the accountability procedures because they know they live in a gray, safe space without that accountability where they can just throw their hands up and say, but I am not this, that, and the other.
Mm,
But I do have something that I can sell you and make money to make you feel better because they are trying to hurt you. I think that we have to, as leaders in spaces requiring expertise, have to start demanding accountability for those bad actors. And there are a lot of bad actors. And I'm glad to see that now experts are starting to really try to utilize these same social media or these same media spaces or communication spaces. But again, it's hard because we are accountable and everything that is said or done or posted has to be done in a way again that accommodates or takes into account that accountability and liability. So it's still a more difficult space for experts to navigate. But I'm glad to see that it is starting to happen. We have to use our leadership, advocate in the highest spaces, um, to mitigate the noise.
yeah. I spoke with someone who is an expert in their field, and they said, we're too busy experting to go in and talk about all of our expertise.
Yeah.
And
Yeah.
that's a shift, right? It's like, no, no, we need people with expertise to spend the time on showcasing their expertise in the forums that matter. And, our team knows this is something I personally struggle with too, that I'd rather be in closer conversations one to one in intimate gatherings than on a pulpit speaking out. But there are a lot of people out there who have far less expertise than the experts who are out there talking. And we need to balance that voice so that it's almost like a public effort that we need to put in place collectively.
Right.
Two more questions for you, Leah. One being, um, you work with some of the most elite athletes, and you yourself are an athlete. When you think about what resilience has looked like on the court, on the field, in battle with your military experience, what have you seen resilience look like, and how is that lesson applied today?
I think one of the consistent factors with people who are resilient and resilience in general is buy-in to what it is the end goal, that buy-in for the end goal. And it will keep you pushing. It'll keep you, breaking down the doors. It'll keep you motivated when it is the hardest and you want to quit. It is absolutely the buy-in, and you have to have that belief and that connection to the thing. And that thing can be a lot of different things, and it doesn't even have to be the same thing for everyone on the team. For somebody, it may be the championship. For others, it may be the connection with the teammates. For others, it may just be the experience um, that of going through the process. Someone else may just very much experience individual satisfaction with team success. It's different for everyone, but the consistency is that they are fully bought in to whatever that end result is for them.
Yeah.
Love it. Allison, your question.
You were making me think about some of the folks that we've been working with recently where they feel like they're at the brink. They've had that belief for so long in something, healthcare, education, some major institution or goal. And it's been the thing that it can bring them to their knees, but then it makes them come back for more every day because of that belief, and they're reaching that breaking point. And I'm curious kind of what your advice is around that and how you think about, like, how do you know when you're at that breaking point? How do you know when you need to take that step back because you've been so bought in and it's just not delivering in the same way anymore?
I think going back to the most simple part of uh, what made you commit, um, finding an easy success and enjoying it and just taking a pause. I think pausing, our world doesn't allow us to pause. It doesn't allow us to turn off. It doesn't allow us just space to sit and feel.
Yeah.
Um, Disconnecting, we say that, but it's hard because you can't. We're connected in every way, shape, or form. Um, for me, because medicine can certainly bring about those frustrations, teach a student learning something for the first time,
Yeah.
just seeing how, a young person has achieved, remembering what it was like when you got to that first space where you took care of your first patient and you had that glow of satisfaction, like I did the thing, that you are watching someone live their dream. That's always reinvigorating for me. So going back to teaching, raw teaching, early teaching, or just sometimes being in the space with my patients where I don't care about the efficiency. And it just may be a day where I'm late to every patient room. And I just sit and I talk to them and I share pictures and we share stories and we give hugs or high fives. Or I just say, you know what, I got
Fill the
nothing
cup.
else for you, but thank
Fill
you
the
for the
cup.
visit.
Yeah. Yeah.
And
I love that.
that sometimes just takes you back. Okay, I can do this. There is a reason why we do this, and we have hard problems to figure out, but they're worth figuring out. I have to go back to people. For me, it's about people.
People and knowing what it's about and getting back there, it sounds like.
Yeah.
I have one last one for you, and that is we've done a lot of research recently on everyday leadership and what it looks like. And we found this crazy big gap between how a lot of leaders see themselves and how the people that they're responsible for are feeling them show up. And it's creating a pretty significant credibility gap. And
Mhm.
we're working in the healthcare space a lot with administrators in the healthcare space who are leading large hospital systems. What's your take on that credibility gap that exists and how your advice on how you fill it? Because I think that when people are in your presence, they experience that credibility at a high level. And I think that's something we see a lot of leaders struggling to fill right now in an authentic way. What do you make of that?
Yeah, that is hard. You know, when you are in these large corporations or large organizations, be it um, um, for profit, not profit, academic, whatever the space is, that gap in leadership and in the highest parts of leadership to the everyday person is big and sustained. And I don't know how you come up with a simple way of of having that felt for everyone, I do think I think it's more than just presence. I think it's more,
Yeah.
I don't want an email. I don't want another email from leadership. I don't want another town hall from leadership. Town halls aren't helpful when you're talking about big space. I think it's understanding the why and like watching the struggle, like being in the space,
Yeah.
being there, seeing the struggle, hearing how they're addressing the concerns. People in the space that are really doing the work, okay? And everyone's doing their work, right? Everyone has a piece of the puzzle. But when you get into the physical space of that work being done and seeing maybe some of the issues that are being brought, I think that helps with bring like closing that gap because they can
Closing that
see it
gap.
and acknowledge it and recognize it. It doesn't mean that there's some change happening, but when someone can see um, that the nursing shortage is really a problem for us and really being able to take care of our patients. Oh, and by the way, this whole new hiring system that you have where you're paying the travelers who are not committed to being here twice as the much as the person that's been here for 20 years. Yeah, and they're having to work side by side while one is talking about one kind of struggle and the other one's bragging about the next job that they're getting paying this. That's a problem. You need to see what that does to a space, and have a readily available explanation for it. Because I think when you see it that way and not
Yeah.
just on some paper, it hits different. It hits
And the
different
things
for
you're
the real.
saying,
Yeah.
yeah, and the things you're saying, it's so interesting. So our most recent research was on frontline workers. And guess which leaders across all others are being experienced in the best possible light right now by their teams? Frontline managers. And our sense is that it is what you just described. It's being in the shoulder to shoulder that builds the empathy and the true ability to see another person's perspective on the same challenge and understand the realities, not just theoretically, but practically. And it's exactly what you're saying. And I think that is, and I also hear you saying it's just about being you. It's not about a formula or a town hall or show up here, write this thing just the right way. The amount of time I've seen senior leaders spend wordsmithing an
Oh,
email, and when that 15 minutes they just spent in the cafeteria would have gone so
right.
much further.
Yes.
And that's it.
Yes.
Yeah.
Yep.
Amazing.
Something you said, in a noisy world, consistent humane conduct is a signal of legitimacy. I think that's a really important close to the conversation because what you're describing is a level of humanity, of sitting with someone, understanding their reality, speaking to them, honoring their need for information, being transparent and honest about what's really going on. The eye to eye, shoulder to shoulder experience that Allison was describing, that feels like what's lacking. And if it's
Yeah.
lacking in healthcare, which is the most shoulder to shoulder experience one might have with another human being in some of the toughest moments in one's life, we have no fighting chance in like, financial
Yeah, no, we're safe.
services. Yeah, like
Yeah,
who,
I
like
sat with a financial services CHRO recently who was like, "Well, my business heads, they don't. That's not their job. Like they don't think they should do that at all.
yes,
They don't want to do that at all. They're afraid to do that."
yes, but I mean
And
in
what you just
healthcare, if you
described is
can't
the
do it,
very thing.
yes,
Right. Well, and we are encouraging that this,
yes,
by this being our method of communicating, by this being our method of expertise.
yes,
This
Yeah,
is not
yeah,
this is not expertise.
yes,
This is expertise.
yes,
This
right.
is the patient holding my hand saying, "You're going to take care of me. You are going to, I trust that you will take care of me no matter what." That's what it is. A patient wants to look you in the eye and know that they're okay and they will be okay. A nurse wants to look her team in the eye or his team in the eye and know that we will have his or her back. The physician needs to know that that administrator is going to go to bat for them when they have, used every resource to save a life, and not get punished because they didn't follow a financial metric, or they're not going to get paid for heroics, that really are what we're all supposed to be doing. So yes.